All right, let's talk about something that pretty much every single one of us has dealt with at some point: mouth ulcers. You know, those incredibly annoying sores that just show up out of the blue, make eating a nightmare, and then poof, they're gone. But what if they're more than just an annoyance? What are they actually trying to tell us? You know the feeling, right? You're just living your life, maybe eating your favorite food, and bam, you feel it. That sharp little stinging pain on the inside of your cheek or on your tongue. It's this tiny little crater that suddenly becomes the center of your universe because of how much it hurts. Yeah, most of the time they're just a passing thing. But here's the deal. Sometimes those ulcers can be a red flag. They can be a little signal from your body that something bigger is going on under the surface. So today, we're going to dig in and figure out what's harmless and what you really shouldn't ignore. So let's get a little technical for a second. What even is a mouth ulcer? Well, think of the lining of your mouth, that soft skin called the oral mucosa, as a perfectly paved road. An ulcer isn't just a little scratch on the surface. It's a pothole. It's a real break in that lining, a spot where the structure of the skin is actually gone. Okay, let's start with our number one culprit, the one we all know and, well, don't love: the aphthous ulcer, which most of us just call a canker sore. This is the usual suspect when you get that telltale mouth pain. And honestly, a lot of the time, where it comes from is a total mystery. So, what does this usual suspect look like? Well, you'll know it when you see it. It's usually a small, round, or oval spot. It's definitely painful, and it's got that classic red ring around it. That's the inflammation, which doctors call erythema. And the really frustrating part? The cause is often idiopathic, which is just a fancy medical term for we have no idea why this happened. But here's something you might not know. Not all canker sores are the same. Most of what we get are minor ones. They're small, they're gone in a week or so, no big deal. But then you've got major aphthous ulcers. These guys are bigger, way more painful, can stick around for months, and can even leave a scar. And then there's this third kind, herpetiform, which show up as these tiny little clusters of sores that can all merge together. Okay, so sometimes the cause is a mystery, but other times, it's not a mystery at all. There are some very clear external triggers for mouth ulcers, and they usually fall into two big categories: viruses and, well, just plain old physical injury. On the viral front, the most common offender by far is the herpes simplex virus, HSV. It causes those shallow, really painful sores you might be familiar with, but it's not the only one. Other viruses, like cytomegalovirus or even varicella zoster, that's the one that causes shingles, can pop up in your mouth as ulcers too. And then you have the most straightforward cause of all: trauma. You know, you bite your cheek. We've all done it. Or maybe you have a sharp edge on a tooth or a filling that's constantly rubbing. Poorly fitting dentures are a classic cause. Even something as tiny as a fishbone getting stuck can create an ulcer. It's a direct physical injury. So we've covered the mystery sores and the ones caused by outside forces. But this is where things get really interesting. What happens when the ulcer in your mouth isn't about your mouth at all? What if it's a clue to something happening system-wide, throughout your entire body? One of the most fascinating connections is actually with your gut. Now, this might seem strange, but your digestive tract is basically one long tube from start to finish. So inflammation that's happening deep inside your intestines, from conditions like Crohn's disease or ulcerative colitis, can actually manifest at the very beginning of that tube, as recurring sores in your mouth. Sometimes your own immune system is the culprit. In autoimmune disorders, the body's defense system gets its wires crossed and starts attacking healthy cells. In Behçet syndrome, this attack specifically causes recurring ulcers. And in another condition called pemphigus, it creates these big blisters in the mouth and on skin that eventually burst and leave really painful ulcers behind. Your diet, or rather what's missing from your diet, can also be a factor. It turns out that deficiencies in certain key nutrients, especially things like vitamin B12 and folate, can be a direct cause of mouth ulcers. It's like your body is putting up a big flashing sign saying, hey, I'm missing some essential building blocks here. And of course, a weakened immune system can leave you vulnerable. Ulcers can be one of the signs of a systemic disease like HIV. Other infections have very specific tells, like syphilis, which can present with a single painless open sore called a chancre. And in really severe cases where someone has very few white blood cells, a condition called agranulocytosis, they can get these whitish, dead-looking ulcers that don't have that typical red inflamed border. And finally, we can't forget about medications. Sometimes the trigger can be a drug you're taking, or even a severe reaction to a drug, like Stevens-Johnson syndrome, which can cause terrible, widespread ulcerations in the mouth. Okay, so that's a lot of information. We've seen that an ulcer can be anything from a simple annoyance to a really serious warning sign. So this brings us to the single most important question. How on earth are you supposed to know when it's time to see a doctor? Right. So you're looking in the mirror, you see a sore in your mouth. Is this a wait-and-see situation, or is it something that needs a professional opinion? Knowing how to tell the difference is, well, it's absolutely crucial. Here's the most important distinction you need to remember. A typical ulcer is a hole. It's a break in the skin, a loss of tissue. It usually hurts, and it goes away on its own. But something more worrisome, like a lesion called leukoplakia, is often a white patch. You can't scrape it off. It's an addition of tissue, not a loss. And since it doesn't heal, it might be premalignant. That difference between a hole and a patch is huge. So what happens if you have an ulcer or any kind of spot that just won't heal after a couple of weeks, or it's not getting better with treatment? Well, that's when a biopsy might be needed. It sounds scary, but it's a simple procedure where a doctor takes a tiny little piece of the tissue to get it analyzed. That's the only way to know for sure what's going on and figure out the right way to treat it. So the next time you feel that little sting in your mouth, just take a second to think. Most of the time, it's nothing. But it's always worth listening to what your body might be trying to tell you. So ask yourself, is this just an annoyance, or is it a message you really need to hear? Thanks for joining me on The Explainer.